Hello, dementia caregivers. This is Risa Carlton, physical therapist and your dementia coach. This is another episode of Empowering Dementia Caregivers podcast. We will discuss about determining the stage of dementia of your loved one. It is good when you know your loved one's diagnosis of dementia. There are different types of dementia. Is it Alzheimer's dementia, Lewy body, dementia from history of stroke, from Parkinson's? So you know what type of dementia, and then it is important to determine the stage of dementia of your loved one, because you will learn and you will understand how their brain function in that stage of dementia. You will understand more of their dementia symptoms, why is it worsening in that stage, and what caregiving approaches you can do, the simple, practical, effective approaches that you can do to address especially the challenging behaviors of your loved one. Now, Medicare covers an annual yearly visit for seniors for the mental test. They can do that yearly to make sure that, so you can track, and especially when you're identifying the early signs of dementia, I highly recommend it. That's part of your benefit. You can have the annual test. Your primary doctor can do it in their clinic and do the mental assessment. Now, for other health insurance, you can check for your benefit and check if they cover that annual mental test. Also, for Medicare, if there is a significant decline that needs attention of the doctor, they provide that annual visit, but you can schedule follow-up visits if you're noticing that the dementia symptoms of your loved one is worsening. Now, as a physical therapist and a dementia coach, my expertise comes with diving into more detail of what what it means that your loved one is in this stage of dementia, and coach you, teach you about the dementia symptoms in those stages. And more, my coaching is functional, physical therapist, movement, function, and safety, especially when you're caring for your loved one in your home and or your loved one's home, may it be a private home or other home setting. In my clinical practice, and for 20 years of practice, I work with clients and family members with Alzheimer's and dementia. Of course, in my first few years of practice, identifying those dementia symptoms, staging, no idea. All right, so I believe that it is my calling. It is what God prepared me to do, and at this stage of my career is coach dementia caregivers and use my skills because of that 20 years working in skilled nursing facilities, senior living communities, home care, those settings. I was privileged to work with clients diagnosed with the dementia and be able to train and coach the dementia caregivers on how to tackle especially the difficult times, the tough times of caregiving. And for my dementia caregivers, you will agree that you have those days with your loved one. So in our clinical practice, we usually use more extensive mental testing to determine the stage of dementia. And clinically for us, that provides us more of, a detailed information, more accurate staging of the dementia with the dementia symptoms. But then what I'm finding out when I'm coaching my dementia caregivers, it's more it's complicated to understand, and it's hard to follow through, because for me, my dementia caregivers, my teaching method, I want them to understand. When they understand, then they can follow through effectively and diligently. So with my dementia coaching method, the stage of dementia method that I teaching my client is very simple: the mild, moderate, and severe stage of dementia. So it's, you're not healthcare professionals, and I came up with this coaching approach that is easier for you to understand, because you don't have to learn the highfalutin words, the fancy staging, and what comes with it. With my coaching, it's more functional, right? You learn it the simple way. These are dementia symptoms. What are the approaches to help with your caregiving needs? So mild stage of dementia is the beginning of the dementia symptoms. So this is the time when you as a person will notice memory loss, forgetfulness, and as a caregiver, you are noticing that with your loved one. There's changes in the personality, the behavior, the mood, but not very distinct. And it's more of the forgetfulness that interferes with daily life, forgetting, important reminders, important appointments. And usually the mild stage of dementia is really overlooked. And most of us consider that, and I get it from the family members. They considered it as a normal part of aging. So sadly, when the Alzheimer's and other type of dementia are diagnosed, it's already in the moderate stage, because of that belief that, the early signs of dementia, it's part of aging, like they're getting old, but it is not. So that's, I'm a strong advocate for dementia prevention. I strongly believe that it is preventable, and we can prevent it from progressing with when we address it timely, identify what's the triggering factor causing the memory loss, and then of course effective intervention, coaching with Alzheimer's and dementia care experts. Now for mild stage of dementia, because I'm huge on understanding, right, the dementia, especially the brain with dementia. I have a podcast episode that I discussed that, and having that understanding and knowledge, then you're like, oh, okay, that's why my mom is acting this way. Oh, now I understand why my loved one, have those, we call it tantrum moments, sundowning, those challenging behaviors that they experience. We get to be more understanding of what they are going through, because it's beyond their control. It's how their brain is working with dementia. So in mild stage of dementia, your loved one think and reason out like a 13-year-old, teenage years. So for the moms out there, the parents out there who have kids, that will give you a good picture of your loved one behaving. Um, they are very impulsive. They can be stubborn. They want to try it. You know, even if you tell them it's not safe, they will do it anyway. Like driving. What else? And that's the thing in the early stage of dementia. Usually they still live alone and they want to be independent. So your loved one will not let you know that they're having this memory loss, or you know, in some cases, which it happened to me, and considering I'm a healthcare professional, I didn't know what was happening to me. And you know, and all I knew was like, I'm getting forgetful, my memory is slowing, and those things. So masking the dementia symptoms is you know, is real. And they still want to be independent, stay in their home, especially when they live in that home for years, where you grew up and have all the good memories in that home. They will mask it. And also driving, it's hard to let go of driving, because that comes with our independence. We can go places, get groceries, and medical appointments. So mild stage of dementia, your loved one think like a teenager. You know, the impulsiveness, and you will see there's changes in the decision making skills, organizing, planning, forgetting you know, important dates. You know, we say birthday, anniversaries. Moderate stage of dementia, this is when the dementia symptoms tend to worsen. In the middle stage, they with the brain with dementia, they struggle with communicating their needs. And that's when negative emotions happen, because they don't have the brain doesn't have the skill anymore of processing the, you know, like, I'm in pain, I'm hurting, I'm hungry, I'm upset. You know, their brain doesn't have that efficient processing thoughts. And it will come out imperfect, right? Because with the normal brain, we have the filtering. We have filtering that, oh, it's not good to say this or act this way, and we try our best, you know, to act appropriately. But with your loved one with dementia in the moderate stage, that filtering is already affected. So they can be acting combative, argumentative, for, you know, things that they don't want. They cannot express their needs. So you have to understand that they're not attacking you. Don't take it personal. It's how the brain is working, because with the dementia progressing, the brain is deteriorating and losing its ability to you know, to think and reason as they used to. So moderate stage of dementia, this is the stage when they require assistance, supervision at home. I have, you know, clients and family member caring for their loved one at home. When I do home care, they can stay home safely with supervision. Functional, they can still walk around. That will be the early stage of moderate stage of dementia. In the later stage of moderate dementia, that's when they tend to like after an illness, recovery from an illness, they forget how to walk, they forget how to do things, and that's when I come in and do an assessment evaluation work with them, if it's still possible to, you know, to get them back from their prior functioning, like walking around the house with supervision after, you know, decline from an illness. So that's when you know, skilled physical therapy intervention can be used, and work with your loved one at home, getting in and out of bed, because as a physical therapist, I'm an advocate for mobility, movement, improving function, maintaining function. We recommend that, you know, that's based on the assessment, that if your loved one was walking prior to the hospitalization, the illness, it is a skilled intervention to try and get them stronger and teach them how to walk again. Usually they forget, and that's how their brain work. Severe stage of dementia, that's the later part of the later stage of dementia, when they become more nonverbal. They could not communicate, express their needs. So this is the stage where you have to be more sensitive and aware, and, you know, be able to read their emotions and their body language. When is the time that they need the rest, and those caregiving strategies. Now, with the severe stage of dementia, the global deterioration of the brain is severe, and what is usually still functioning in that stage is the limbic system. Limbic system is the emotion center of the brain. So it's that's why we're teaching strategies, caregiving approaches, where you do more of touch, recognition, familiarity, and the hearing, the vision are impaired. They can't see well, they can't hear well, they have a hard time understanding your words, instructing them, you know, for daily activities like getting dressed and eating. So that's why it takes a lot of cueing for them and assisting them. So moderate stage of dementia, the brain function as the 4 to 12 years old. So that's the toddler years. And then severe stage of dementia is a newborn to 3 years old, where they get very dependent in that stage with your care. And that's when, you know, you do a lot of things with the dressing, even feeding. So it is very important to know the stage of dementia of your loved one. If your loved one is already diagnosed and you already know what is the type of dementia they have, Alzheimer's disease, any other type of dementia, that's good. That's what the primary doctor can provide at the office. And so with physical therapy, being expert in Alzheimer's and dementia care, I work more on the function. And Medicare and other health insurance cover home care visits for physical therapy with your loved one with Alzheimer's and dementia. We can do assessment. We can do recommend visits as necessary to work on the functional goals. And also I offer a cash pay physical therapy when your healthcare insurance is exhausted or insurance determined that skilled physical therapy intervention is no longer necessary, which means that um, it can be more of a maintenance for neurologic conditions. Medicare covers maintenance program for um, neurologic diagnosis, but you gotta justify why um, maintenance program is important, what to work on, and it has to be a skilled intervention. For the cash pay physical therapy coaching that I provide, we can go more of what your health insurance doesn't cover, and within that, working with the physical ability and mental ability of your loved one. I hope this is educational and beneficial to my dementia caregivers. And if you have any question, put it in the comment section, so I know your concerns. And like and subscribe my podcast, so I will continue making educational, informational discussions and topics for all of you dementia caregivers. And watch for the upcoming episodes. Thank you so much. Until next time.